Assalamu alaikum and hi all doctors. This is second video related to MRCEM anatomy MCQs. So first question is a 32-year-old man present after a knee injury to the lower lateral neck. On examination there is loss of sensation in the supraclavicular fossa above the clavicle, while the upper limb motor exam is normal. Which dermatome is most likely affected? So answer the question. Dermatome of upper limb and lower limb and abdomen are important, asked in the exam. 2 3 MCQs from dermatome. So answer is C3. C3 supplies supraclavicular fossa via supraclavicular nerve. Second scenario, a 28-year-old man present to the emergency department after a stab wound to the posterior lateral part of his back. On examination, he has weakness in the extension, adduction, and medial rotation of the arm. Which muscle is most likely injured? Answer this question. So correct answer is latissimus dorsi, large posterior lateral back muscle responsible for arm extension, adduction, and medial rotation. Shoulder muscle and sits muscle always asked in the MC exam. So latissimus dorsi nerve supply is important, supplied by thoracodorsal nerve C6 C8. This is third. Recall MCQs. A 45-year-old man present with shoulder pain after a fall. On examination, he cannot initiate the abduction of the arm, but when the examiner passively lifts the arm slightly, he is able to continue abducting the arm up to the shoulder level. Which muscle is primarily responsible for initiating abduction of the arm? So, initiating the abduction of the arm, which MCQs, which option is correct? Correct answer is the supraspinatus. Supraspinatus initiate the first 0 to 15 of arm abduction at the shoulder joint. Then it is responsible deltoid responsible for abduction of arm from 15 to 90 degree. This is fourth clinical scenario. A 35-year-old man present after a fracture of the cervical neck of the humerus following a fall. On examination, he has a weakness in the shoulder abduction and difficulty in the lateral rotation of the arm. Sensation is reduced over the lateral shoulder. This MCQ always repeated in the MRCEM Primary. Regimental batch area is supplied by the which nerve? Which muscle responsible for lateral rotation of the arm is most likely affected due to this nerve injury? So, teres minor is supplied by the axillary nerve. Teres minor, lateral rotation of the arm and supplied by the axillary nerve. This is last MCQ. A 30-year-old man present after a deep laceration on the sole of the foot. Examination suggests damage to the structure in the first layer of the plantar muscle. The patient has difficulty flexing the lateral foretoes at the proximal interphalangeal joint. Which muscle is most likely injured? Option A quadratus plantae, B lumbricals, C flexor digitorum brevis, D flexor hallucis longus, E adductor hallucis. So the correct answer is flexor digitorum brevis. Flexor digitorum brevis, first layer muscle that flex the lateral foretoe at proximal interphalangeal joint. Thank you for watching this video. Comment, like and share and subscribe.